Hello everyone, I am Tanvi Velinka from first year and the topic given to me is Laboratory Manual of Anumana. So, what is Anumana? Anumana is a compound word in which Anu means afterwards and Mana means knowledge. Altogether, Anumana means knowledge gained after Pratyaksha. Pratyaksha Pramanam denotes sensory perception. Here, the individual gains knowledge through the medium of sense organ. Anumana is a sadhana or the karana for the anumiti. So now, what does the anumiti mean? Anumiti is the knowledge which is produced by or after the paramarsha. Now, to come to Anuman, case study of a patient plays a very important role, such as name, place, occupation, sex of a patient, as certain diseases are predominantly seen in a particular sex. Then, the chief complaint or symptoms that patient has, such as any swelling, pain, fever, etc. History of patient also plays a key role as many diseases do recur in families. Then, if a patient has any sort of allergy or any drug allergies in particular. Now, to understand how Anumana is done, we will see some of the case studies of the patient. Case study of the first patient says that he has a symptom such as frequent urination, increased thirst, fatigue, and weight loss. He also mentioned about his observation of ants near his urine, which is generally the condition when there is a large amount of glucose present in the urine. He also has genetic history of diabetes. So, after considering all these points, we can say that frequent urination is a polyuria condition in which, due to high level of glucose, kidneys are not able to reabsorb. So, glucose enters into urine, thus leading to frequent urination. And due to this increased urine loss, patient is complaining of increased thirst. The other symptoms such as fatigue, weight loss are because of increase in glucose level and decrease in insulin sensitivity. So, from all this, we can come to an anuman that patient might be having diabetes and that is the reason he has symptoms of diabetes such as polyuria, polydipsia, fatigue, weight loss, and also he has genetic history of diabetes. To confirm this, doctor may take the help of some pathological tests such as HbA1c, fasting blood sugar, a complete blood count test that is ABC, and insulin autoantibodies test that is IAA. Case study of a second patient says that patient is complaining of severe weight loss, difficulty in breathing, or shortness of breath after a short walk or after climbing stairs, decrease in concentration, and pale skin. This symptoms indicates that patient's body is not getting enough oxygen-rich blood. This usually happens in case of less hemoglobin count in the body. Hemoglobin is essential for transferring oxygen in your blood from lungs to the tissues. So, due to this lack of hemoglobin, patient's body and brain is not getting enough of oxygen and hence patient is complaining about fatigue, decrease in concentration, pale skin and shortness of breath. So, from all this, we can come to an anuman that patient might be suffering from anemia and hence has the symptoms of low hemoglobin in the body. Pathological tests which help the doctor to confirm this and to know the hemoglobin count in the body are CBC, that is complete blood count, iron profile, hemoglobin electrophoresis, peripheral blood smear, abdominal sonogram, and bone marrow analysis, etc. Third case study says that patient has twisted, enlarged veins and the occupation of the patient is barber. Here, the occupation tells us lot of things because twisted and enlarged veins are caused because of continuous standing for long hours, which increases the pressure in the veins of the lower body and blood gets collected in these veins. And this condition is known as varicose veins. So here, based on patient symptoms, that is enlarged veins and occupation, that is barber, we can come to an Anumana that patient must be suffering from varicose veins. To diagnose this, doctor may recommend a test called as venous Doppler ultrasound of the leg. The fourth case study of a patient says that patient had high fever for 2 days along with continuous vomiting causing dehydration, loss of taste after having fever, severe weakness and rash. Such kind of rash is caused when there is low platelet count in the body. So, after looking at these symptoms such as low platelet count, that is thrombocytopenia, along with fever and other symptoms, we can come to an अनुमान that patient might be infected with dengue. And to confirm this, doctor may suggest pathological tests such as detection of antigen, serological tests, and hematological tests. The fifth case study of patient says that patient has high fever along with sore throat, weakness, loss of taste and smell, difficulty in breathing, and had came in contact with COVID positive person. So, after looking at all these symptoms and the fact that patient had come in contact with COVID positive person, we can come to an अनुमान that patient might be been infected with COVID, and to confirm this, doctor may recommend antibody test, RT-PCR test and LFT test. So, after looking at all these case studies, we can say that patient symptoms, history, occupation, and sometimes pathological reports helps the doctor in Anumana Pramana. Thank you.